Okay, good morning, everybody. Dr. Arefich here, Vet Triage, October 20th, Sunday, 9:45 a.m. Pacific time. We are going through this JAVMA journal. It is JAVMA, January 15, 2016, and the specific article for today, Pathology in Practice. A 2-year-old female intact mixed breed dog was evaluated because of possible tetanus. She had a 4-day history of hypertonia, stiff gait, and fractured nails on her right and left forelimbs. So just to get into this, hypertonia means an increase in tone. Normotonia means normal tone. Hypotonia means more flaccid or less tone in the legs. And by tone, we mean if you have the pet on their side, let's say, and you're pushing from the bottom of their paw pads, and you're pushing like to make their legs contract, how much resistance they are pushing against you is how you determine tonicity of their limbs. So let's say this is the dog's leg and I'm pushing on the paw. If it's like really hard to push, that's hypertonic. If it's really flaccid, it's hypotonic. That's just one way of testing it. There are other ways. And the initial evaluation, hyperthermia was seen at 106.4 degrees Fahrenheit. So normal is probably around 100 to 102.5, sometimes a little higher. Some dogs run a little high as well, especially dogs that are like working dogs. But in general, of course, 106.4 is too high. Electrocardiography revealed tachycardia and second-degree atrioventricular block. There was progression of hypertonia to opisthotonus, extensor rigidity, trismus, and rhesus sardonicus. When stimulated, the dog developed whole body tremors. So opisthotonus is when the patient is in pretty much permanent rigidity with the legs, and also the neck is extended backwards, and it's just showing that the body is tensing severely. Extensor rigidity is exactly that. They're rigid in extension as opposed to rigid in like flexion or something like that. Trismus and rhesus sardonicus. So trismus is pulling back of the face because of tetanus, let's say, or any other reason, but in this case, tetanus, where like the ears are pulled back, everything's kind of pulled back, and the sardonic grin, rhesus sardonicus, is like almost like the Joker from Batman, like the lips are being pulled back because of a neurologic condition. All of it is related. Blood work showed leukopenia, neutropenia, anemia, hypoproteinemia, hypoalbuminemia, hypokalemia, and hypoglycemia, but also sometimes hyperglycemia, elevated alanine aminotransferase, variable hypofibrinogenemia to hyperfibrinogenemia, and prolonged clotting times. So let me repeat that. Low white blood cell, low neutrophil count, low red blood cells, low protein, low albumin, low potassium, low glucose, but sometimes high glucose, high ALT. ALT is a enzyme that's associated with usually liver, but also can be muscle and other organs. Sometimes low fibrinogen or high fibrinogen. Fibrinogen is a byproduct of clot breakdown. And so if the body is forming a lot of clots or breaking down a lot of clots or both, then you'll have high fibrinogen levels, and it indicates potentially a coagulopathy or a bleeding disorder. And then prolonged clotting times indicates a coagulopathy. They began treating with crystalloids, colloids, sedatives, muscle relaxants, antibiotics, nutrient support. On day 8, the dog was sedate, still had extensor rigidity and tremors, now had a bradycardia, so a low heart rate, whereas before there was tachycardia, which is a high heart rate. Urinary catheter was functional. Dog had melena on examination. They continued treatment with fluids and electrolyte replacements, as well as Valium continuous rate infusions of CRI, dexmedetomidine, methocarbamol, which is a muscle relaxer, and they were confused at the hospital by the dog's severe hyperkalemia, so the high potassium. And so we're going to go through a bunch of rule outs now for what high potassium means. And the goal here is to figure out, do any of these causes of high potassium actually make sense for the patient? So anuric or oliguric renal failure, post-renal obstruction, inappropriate fluid administration, acid-base disturbances, Addison's disease or hypoadrenocorticism, insulin deficiency, pseudo-hyperkalemia, or factitious causes, including hemolysis that's seen in Asian breed dogs, collecting samples from dogs that have thrombocytosis, delayed separation from the serum and plasma, contamination of the sample with potassium EDTA or other potassium-containing fluids, and collecting the sample through a heparin-lined IV catheter. So those are all the different causes of hyperkalemia. A dog with serum potassium concentrations over 7.5 millimoles per liter would be expected to have clinical signs, including myocardial excitability, progressing to depressed excitability, and conduction velocity. So that's affecting the heart. And then their comments. Although commonly referred to as a laboratory error, diagnostic testing error can occur at all stages of testing, from the time that you collect the sample to the interpretation of the final report. So in this report, they said, hyperkalemia doesn't make sense with this dog potentially having tetanus, and none of our diagnostics are proving all those other reasons for hyperkalemia, so it must be a laboratory error. So they went through and they figured out it was actually a laboratory error, and so this whole discussion is based on that. Commonly, diagnostic errors are classified as either pre-analytical, analytical, or post-analytical errors. Pre-analytical occurs prior to performing the test and manifests as accurate analysis of the sample that does not accurately reflect the patient. This can involve alteration of the sample or mishandling it. Analytical errors occur during the test process as either operator error or instrument error, which lead to inaccurate test results. Post-analytical errors occurs after a test has been performed and manifests as accurate results that do not trigger appropriate patient management. So an analysis problem. Post-analytical errors result of improperly recorded test results, failure to deliver the result to the clinician, inaccurate reference ranges, or improper interpretation of the results. One veterinary medical report on analytical error indicated that, in general, in-clinic laboratories met the minimum performance standard for 73% of analytes tested, whereas reference laboratories, so external labs, met the standards for 91%. So even in a lab the whole reason why they're beneficial is that they run rare tests, but also their machines are usually often calibrated. They have staff that are trained for this, and even they only have a 91%. They only meet the standards 91% of the time, and 73% for clinics is terrible. Pre-analytical error can include, and so this is like in this case, for example, IV fluid contamination, transfer of anticoagulants between tubes, contamination of the skin surface, bacteria or antiseptics used to clean the venipuncture site. All that have been observed. Current medications or inappropriate patient preparation can influence pre-analytic errors. Sample handling issues such as underfiltered tubes or hemolysis associated with excess pressure generated by a small gauge needle or vigorous collection techniques can induce errors. And additionally, incompletely filled out forms or label samples are also common causes of pre-analytical errors. All three causes of errors are prevented by adequate training of staff, appropriate and ready available protocols, equipment and protocol validation, ongoing routine quality control testing, and the addition of analyzer maintenance and upkeep. And then finally, it says here, just as important as a clinician knowing how to interpret diagnostic results is their ability to adequately discriminate which results should not be interpreted. So I think it's a great report outlining probably the apparently very common issue of pre-analytical errors. I did wish it went more into tetanus infection in dogs, just for the sake of learning. But I know the point of the paper was that. So just for folks who don't know, Clostridium tetani is the bacteria that releases the toxin tetanus and causes those neurologic changes in dogs. Tetanus often is the result of a dog that got cut by a piece of metal that had rust on it. That's where tetanus will live. Or if you have a botched surgery, they didn't use septic technique, then tetanus can come from surgery as well. And then usually it doesn't manifest right away. It takes time for the bacteria in a fairly anaerobic environment to create these spores that then start releasing the toxin. So I'm sure we'll go over it in a future article. It is very uncommon. In my opinion, I've only had maybe like one case that I can remember, and they require many, many days of ICU. Usually have to be on a ventilator because they can't breathe on their own, and it's sad and expensive to treat those dogs. So, and in people, we get tetanus vaccinations, right, to prevent this. So, I don't know about it in dogs. I'm not that familiar with the condition. All right, thanks everybody for joining. We'll see you again tomorrow for another one. Bye, bye, bye.